attendees are in listen-only mode.
Good afternoon, everyone, and welcome to the application Q&A webinar for the ONC Market R&D Pilot Challenge. Next slide, please. My name is Adam Wong. I am the manager of the Prize Challenge program at the Office of the National Coordinator for Health IT, the Investing in Innovation, or I2 program. Also joining me today is Graham Ossie, the Senior Program Manager from 2.0. Our agenda is pretty basic today. I'm going to talk very briefly about the challenge itself. Then we're going to move to, and Graham is going to cover the application template, and then we'll move to Q&A. Next slide, please. So I'm not going to spend too much time talking about the challenge, but just want to restate that our goal with the Market R&D Pilot Challenge is to advance innovative uses of health IT by bringing together healthcare organizations and innovative companies and facilitating pilot testing. And of course, within this big overall goal, specifically, we want to encourage early collaboration between medical personnel, entrepreneurs, developers, startups, and patients in order to link innovation in health IT to innovation in healthcare delivery. We want to de-risk several early-stage digital health products for future testing and investment in implementation. We want to encourage uptake of ONC standards and technologies, and we want to contribute to the public knowledge base or technical resource base. And before going any further, I just want to give a little update as to the kind of interest and some of the numbers that we're kind of measuring the challenge by. So we have had over 10,000 unique visitors to the challenge website, and again, that is oncpilotchallenge.com. We've had over 450 people sign up to receive updates. We had over 180 total organizations attend our live matchmaking events in January in San Francisco, New York City, and Washington, D.C., and that includes over 330 people from those organizations. So that's just a quick review, and with that, I'm going to go ahead and turn it over to Graham to talk about the challenge application.
Thanks so much, Adam. It's a pleasure to be on the webinar today. Just a couple quick reminders before I jump into the application. If you have any questions on the webinar today, feel free to enter them into the GoToMeeting questions chat box, and we'll be able to answer those questions. Keep in mind that if it's very specific to your application, go and email us instead. You can email us at challenges@healthtucon.com, but we'll answer anything that's not too specific to a specific application today. And secondly, please visit the website, oncpilotchallenge.com, and you can always find this information up there and ask questions there as well. So if we can go to the next slide.
And this webinar is being recorded, and that recording will be posted on the website also. Sorry, Graham.
Yep. No. Thanks for jumping on. That was something I wanted to mention. So we can just go to the next slide, please. This is the ONC Market R&D Pilot Challenge Joint Application Form, and you can find it on oncpilotchallenge.com, both on the announcement bar on the top of the page or by clicking the Enter Now button. And on this has a number of different links, different things you need to fill out to apply. The most important piece of this is the template. So as you go at the top of the slide, it says, please note you must use this template for your pilot proposal. Every application that's submitted to us needs to use that template, so our judges have a standard way of reviewing what you guys submit to the challenge. The reviewers need the standard templates to maintain a fair process. As you can see at the top of the application form is a lot of information that you'll need. You have until 11:59 p.m. Pacific time on March 2nd to submit your application. The evaluation criteria, eligibility requirements, etc. are also linked there. Next slide. So on the, in addition to the template, which we'll go over in a bit, you must also select which domain your pilot addresses. Sometimes that can be multiple domains, so please indicate which domain you're in. You also have to indicate the funding level that the innovator will receive and the host will receive as part of the pilot. As you all know, you must enter this challenge together. There must be two entities, a host defined by the eligibility criteria and an innovator defined by those criteria as well. And we're asking you to say, if you were to win the challenge, how much funding would you would go to the host and to the innovator? And that is not percentages. We're looking for dollar amounts. On the next slide, you'll see the beginning of the template. And the template has a lot of different information that we'll need from you, including your pilot proposal on the next slide, which has a series of questions for you to answer about your pilot, which will help the reviewers understand your project. On the next slide is the pilot budget. The pilot budget is a way for the reviewers to evaluate the feasibility of your pilot, the scale of it, and you'll notice that there are a couple of different columns here in the spreadsheet. The first is the budget items. So we're asking you to detail what you'll be spending money on during the pilot, the cost, the quantity, and then the in-kind or funded. Please note that the winners will win, up to 6 winners will win $50,000 each. And we're asking for you to note whether the cost will be in-kind or funded, simply to know what support, what scale your budget is at. But each winner will receive $50,000. And on the next slide, you'll just see the timeline of the process. The joint applications are due on March 2nd. The evaluation period will last for just about a month after that. And we're anticipating announcing the winners on April 30th. And throughout the late spring and summer, we'll begin the pilots and help the winners prepare for their pilots. And the pilots should last, 4 months or longer, and will be complete hopefully by January 2016. On the next slide is just, again, the website, oncpilotchallenge.com. All the information is there, along with our contact information, which is below, and you can reach us at challenges@health2con.com. The bulk of this webinar today is going to be dedicated to your questions. So please, if you have questions, enter them in the GoToMeeting control panel box, and we'll begin to answer them.
So as we wait, thanks, Graham. Go ahead. Sorry.
No, I was going to say Alicia from Health 2.0 will be asking questions, but I was going to turn it over to you, Adam. So go ahead.
Okay, thanks. So as we wait for questions to come in, I just want to say that we've got an hour slated for this webinar today. If we get more questions than we can then fit into the space, then we have your email addresses, and we can get in touch for anything that we don't get to. If we end up not needing the entire hour, then we will give you some time back this afternoon. So while we wait for more questions to come in, I just want to address a couple of things that come up in pretty much all of our challenges. The first is eligibility. So per the America Competes Reauthorization Act, under which we are executing this challenge, all companies, host organizations must be U.S.-based entities with a primary place of business in the United States. And then another is about intellectual property. So the actual application that you are submitting is not the technology itself. It is the application materials that Graham just went through, including your narrative, the pilot budget, and I believe the slide deck and video. And so you will retain all IP, for your products. Nothing is getting purchased or appropriated or anything like that by the government. And so with that, Alicia, why don't you go ahead and start throwing some questions at us.
Thank you, Adam. Just to reiterate, this webinar is being recorded and will be posted on the ONC website following the webinar. So our first question, is it permissible for the host to provide support in kind while the innovator, if awarded, uses the funds to use the technology as is and then customizes it to a specific host?
So that's a great question. The way the winners will be funded is there's $50,000, and as I mentioned earlier, you will indicate how that money will be split between the host and the innovator in your joint application together, just so everyone agrees to it. 100% of that can go to the innovator, or 100% can go to the host, or any split in between there. So the answer to the question is yes, the host can provide in-kind support, and the innovator can receive all the funding as long as the host agrees to that as well. Yep.
Thank you. Is there a place in the form to provide information on a third-party organization, such as a community-based organization, that is involved with the pilot?
Yes. So I think in the proposal section, yeah, we would definitely like to see that information. So even if there aren't specific fields for a third organization, but you can put that into the proposal section.
And I'd just like to add that there's also an additional information section of the template, so you can use it like that as well.
How important is the video requirement to the overall application?
So the way the reviewers are evaluating the applications are to look at them holistically. They'll have access to videos, to the templates that you fill out, to your slide deck, and they're going to review all that information as a way to evaluate your entire application on the evaluation criteria. So the video is no more important than the slide deck and the template. Obviously, the template gives you the best chance to explain in detail what you're going to be doing in your pilot, but there's no weighting of importance on any single piece. Domains expected to receive funding, or is there any allocation there?
We are planning to select the top 6 applications, or top up to 6 applications overall. So it is not a guarantee that each of those domains will be awarded. If there are 7 applications that are kind of scored high enough to be funded, and there are 6 in the provider-based, hospital-based clinical environment, and 1 in the community environment, then it's kind of up to our discretion to pick to diversify a little bit, and that would be the ideal case. But the general intent is to pick the top 6 period.
Great. And related to that, Adam, is there any sort of priority area or focus of these applications that are more important than others, or is everything of equal weight?
I think they're all on pretty much the same level. We're really going to stick to the review criteria when it comes to the evaluation of the proposals, and I think probably more important than the domain or the specific domain that you kind of categorize your application under is the relevance to ONC initiatives, which is one of the defined criteria.
Great. We have another question about how the funds will be dispersed. So just as it's made clear on the application form in the template, the plan is to disperse half of the winning money up front and half on the delivery of the final deliverable. So every pilot that wins is required to write a white paper or something that can contribute to the public knowledge base based on that pilot. So $25,000 will be awarded to each winner up front, and $25,000 once that deliverable is delivered. What role, if any, is the ONC going to take in terms of formalizing the results of the pilot? That's for you, Ed.
Yeah, so there are a couple of things that we are hoping to do, with the results. So there's going to, at the end of the pilot, there is going to be kind of a evaluation type report that will be submitted to us, and then also the public deliverable that we're asking for. Over the course of kind of advising and monitoring and tracking the pilots as they run, we're really hoping to learn new things about running pilots that will inform our own internal programs in the future, and hope that there are also lessons learned and best practices that we will be able to release both kind of on our website and to the community in general, that can help teach the entire community about running pilots. So I can't really state that there is we're going to we have a defined format or anything about exactly what we're going to release. But between the public deliverables, the kind of integration, into our own internal programs, the kind of celebration and publicizing around the winners, and at the end of the pilots, I think there's plenty of kind of information that we will be kind of getting out, over the course of the challenge.
Great. There was another question about the prize money. So just to be very clear, 6 teams who will win will each receive $50,000. That's 6 pairs of companies that enter. There will be six $50,000 awards. The next question is about the budget, and the question is asking, say there's one line item that will be both funded in kind. Say, for example, used in the pilot's budget, there are Chromebooks that were listed there, and say half of them were funded and half of them were in kind. What do you do in that case? And the answer to that is that you should list them as 2 separate line items and just indicated how much are in kind and how many are funded by the program. So another question that I'll send over to Adam and maybe try and answer myself is, what are the most important factors that one should highlight in the application? Is it the metrics? Is it something else about the application? And I'll say that just keep focus on the evaluation criteria. We're trying to, that's our way of telling you what people are going to, what the reviewers are going to be looking for in your application. But Adam, is there anything else you'd like to add to this?
Yeah, I think a good application is going to have a combination of good description of the technology and the kind of intended and planned for outcomes of the pilot, while also having a good detailed budget and any relevant metrics or numbers associated with the technology and the pilot. It's not. It's kind of. It really kind of depends on the application, I suppose. But we're looking for the most compelling argument, of why we should, of why your pilot proposal should be selected. And I think it's just kind of a good rule of thumb that combines both, quality narrative and relevant detailed metrics.
Is it okay for a host company to take $0 in funding if they choose so? And again, the answer to that is yes. We are leaving the choice of how the funds are split up to the payer who's applying. And so if a host chooses to take $0 of the winning funds, that's okay. If the innovator chooses to do so, that's also okay. And any percentage in between works as well. So Adam, can you please elaborate a bit on the evaluation criterion? We can actually move up to an earlier slide that details them as well.
Great, thank you. Let's see. So that actually cuts off a little bit. Let me pull up the review criteria real quick so I can discuss so I can touch on each of them.
We can come back to that question, Adam, and we'll answer another one in the meantime.
Okay, great.
So what is the difference between the important measurements and time frames, and what will you be measuring on a regular basis questions? I think that's a great question. I think some measurements are going to be taken at the end of a pilot and are not going to be, regular metrics, and I think that's one way to serve as a distinction between those two questions. And so I would encourage you to think about what things you're going to be measuring throughout the entire pilot to help you understand how you're doing in the moment, and what things are going to be retrospective from the end of the pilot. And is there a guideline to the length of the video? And in an application form, it says 3 minutes. So please limit your video to a 3-minute demo of the technology that will be used in the pilot. And Adam, I'll go back to you on the evaluation criteria.
Great, thanks. So there are 7 criteria that are presented on the joint application form, and they're all weighted separately, but fairly nothing is too different from the rest. So there's no one criteria that counts for half of the final score. So the first one, and that is worth a quarter of the final score, is the pilot proposal and design, which includes the quality of the pilot concept, feasibility, potential for success, and ability to meet milestones, sustainability, scalability of the pilot to a broader population. So just to sum that up, that is all really your pilot proposal and design and likelihood of success. At 15% is the pilot budget. I think that's pretty self-explanatory. That will mostly be covered within the spreadsheet. The next two both mention potential, but they are slightly different. So innovator company's product potential, which we say includes innovativeness of technology product, capabilities, and potential for commercial success. So that really focuses more on the future ability of the product to be successful and sustainable in the market. Whereas the next one, potential for health impact, includes potential impact on critical health IT or healthcare need. So that is more about how the product itself tackles health IT or can affect the particular health problem that you're tackling. Next is team experience and strength of match at 10%. And again, I think is fairly self-explanatory. So that's the experience of the team members, prior successes of the team, in working and bringing technology to market, and also the fit between the host and the innovator. So if it doesn't seem like there is, if there kind of seems like there are differences in the application or substantive differences that might cause friction or might indicate a potential that success is going to be less likely, then you might get dinged on that in this criteria. Relevance to ONC priorities. So, first of all, the application, should fall into one of the specified ONC priority areas, and within that, and I think those are fairly clearly spelled out. But if you indicate that it falls under one particular area, but it kind of drifts away from our central interest in ONC's interest in health IT, then that could result in a markdown. And then lastly is the proposed public deliverable, which I mentioned before. So this is something that we want to be able to release to the public that either augments the knowledge base, so that could be like a journal article or white paper, or the technical resource base, like an API or an open data set or kind of an open source tool or something like that. We also say, or other no-cost contribution to the public. And so, that public deliverable is kind of, up for negotiation. We'll get a basic sense of what you want to do. The more detailed, the better at the application stage. But what you submit or what you propose now within the application is not absolutely 100% set in stone. So if something develops during the course of the pilot that would augment or slightly change that initially proposed deliverable, that's something that we'll talk about. And so, yeah, that's the criteria.
Great. Thanks, Adam. We have a number of questions that are focusing on either specific domains or specific priority areas that a specific team's application would fit into. So I'm going to request that if you ask a question about a priority area or a domain of your specific application, just email us, and we'll get you that answer as well. Can a facilitator organization donate resources, not money, on top of the grant to make the host succeed? So there are two ways I could interpret that question. I think the first way is that it's a third party to the application. So there's a host and an innovator applying a third organization who wants to donate resources. And for us, unless, Adam, you think it's otherwise, I think that's totally fine with the application. Just note that the money for the winning pilot can only be paid to the innovator or the host, not to a third party. And if that question was meant to mean that can the host donate on top of any funding, and that's very clearly yes. The host can donate resources, technology, financial resources, whatever it may be to make the pilot succeed. There's another question about the 4 domain areas. So again, if we can just move to that slide on the domain areas. Let's show the domain areas. They're the clinical environment, such as hospital, ambulatory care, or surgical centers, public health and community environments with community-based personnel, such as public health department, community health workers, mobile medical trucks, or school-based clinics, consumer health, such as pharmacies, laboratories, or research and data that, for example, provide novel ways of collecting data from patients. Obviously, not every situation is covered by those. And, for example, consumer health includes a lot more things than were listed there. So just try and make check off the right box for your pilot, and you can check off multiple boxes, I believe. So the reviewers will be evaluating and make sure that that fit is right. So just try and make it the best pick. And if you have specific questions, feel free to email us. If the innovator and the host don't fully define the pilot scope by the March 2nd deadline, will the application still be accepted? Adam.
we need to have the pilot proposal, the scope, fully defined in order to, really, make a good decision. There's nothing functional that will, keep you from submitting an application that does not have the scope fully defined. But if it's not, then, that will be reflected in the pilot proposal and design criteria.
Another couple questions here on the budget and what can be covered in the budget. And really, we're just asking you to provide the budget so that the reviewers can understand how you'll use the pilot funding. Obviously, the money should be used for the pilot, but staff costs, technology costs, salaries can all be included in that as well. So please include the costs for the pilot. It will help us or help the reviewers better evaluate your proposals. Is there a published selection committee in addition to the ONC team? That's a great question. We are finalizing the team as we speak, and we'll hopefully be able to publish them very soon. But they're going to be leaders from both the private and public sector who really understand health and health technology and what it means to pilot those technologies.
And that'll be up on the website by the end of next week. And we're very excited to reveal who is going to be participating.
And we're down to our last questions of the day. So if you have any more, feel free to put them in now. Or again, as was on the last slide, you can email us at challenges@health2con.com or go to oncpilotchallenge.com. There's a question about a product, the product demo, and whether how to create a video for a product that's not yet created. So I think the key here is that this pilot challenge is focused on technologies that are already created that can be tested in one of in a host setting. So that doesn't mean that no further development work can happen or customization of the tool that needs to happen to work in a host environment can't happen. But we're anticipating that the applications have products that are functioning and are ready or nearly ready to be tested in the host environment. Question for you, Adam. If the budget of a winning proposal is less than $50,000, will the winner still be awarded $50,000?
Yes, they will. So the award amounts are $50,000, no more, no less.
Great. And again, I think that confusion is coming from the budget, and the budget to help the reviewers evaluate the pilot that does not affect the potential funding. There's a question about how many applications are we anticipating receiving. So that's a really great question, and there's no good way to predict the exact number that will come in. I know Adam shared some metrics about the challenge earlier, so a lot of people have expressed interest in the challenge and been involved in matchmaking and other processes so far. So there's no good number that we can give you, but we're anticipating it being a pretty competitive challenge. And we've had this question from both ends, so can a host or can an innovator be involved in two different applications? So the answer to that is yes. An innovator can apply with multiple hosts. A host can apply with multiple innovators, as long as everyone meets the eligibility criteria, excuse me. But the key is that only one application from an entity will win an award. So if Innovator X applies with two different hosts, only one of those applications will win a $50,000 prize.
And to the degree that each additional doing an additional application results in less effort going into each application, we would strongly suggest, we would prefer that each entity only applies once. There aren't restrictions on the number of applications that we submitted. We strongly suggest, the fewer applications from each entity, the better. And as Graham said, there are six awards, and therefore 6 innovator companies and 6 hosts, being awarded. And a company or a host can be awarded no more than once.
And our last question of the day is, can a host be a current client of an innovator company? And I think it's a little more complicated than the yes or no answer here. The short answer is yes, but we're hoping that the pilot is a novel test of the technology. So the idea is not to award something that's been implemented and used already and just award funding, but to really test out the technology. Adam, do you have anything to add to this?
No, I think that sums it up.
Okay. Well, that is the end of our questions for the day. Again, we're recording this webinar. We'll get it transcribed and put it up on the website, that's oncpilotchallenge.com. Of course, you can always email us with questions. So, Adam, if you have anything else, feel free to close the webinar.
Yeah, for those of you who had kind of a domain-specific or ONC priority-specific, priority area-specific questions, please go ahead and get in touch, and we will get back to you as soon as possible with answers there. And again, I just want to thank everyone for tuning in today. So applications are due March 2nd, which is something like 18 days or so. We are really excited to see what comes up. Challenge reviewers will be up on the website by the end of next week. And thank you all again, and enjoy the rest of your week. Thanks. Bye-bye.